Hello. We are the 9th April 2020. It is 4 p.m. GMT, 5 p.m. here in Luxembourg. We are in my home. You see the view in the background. And I have to admit that my dog is on my feet, just under the table. I am suggesting you today what I have entitled my Covideo I. There will be a second part. Covideo, I guess you understand the name and you guess what we are going to speak about. One is part one, which will cover some general information about COVID-19 pandemic. I plan to make it last around 15 minutes. I hope I can cope. And there will be a second part, Covideo II, that will focus on what I recommend as an effective prevention. Let's start with the general approach, but I want to stress the fact that we will focus, generally speaking, on a non-drug-based approach, something typical of functional medicine, and that seems to work well. We are having good results for the moment at this stage of the crisis, with no hospitalized patient and no patients experiencing more than some mild, moderate symptoms, and probably a number of those with no symptoms at all, or just hard to perceive symptoms, which are all good news. Alors, let's start with the symptoms. And there are plenty of potential symptoms. Of course, the foundation symptom is this flu-style situation with fever, pain, cough, etc., as you would find in the classic flu. However, pain is more severe, a lot of headaches, sometimes really nasty, a lot of backaches as well, more pain than usually when you feel under the weather. Cough can be dry, but not necessarily. It can turn into a productive cough pretty quickly. And fever, well, I don't have many patients with a lot of fever, hardly any fever. Might be due to the immune protection brought by functional medicine programs. But of course, touch wood, I'm on a wooden desk, so I'm certainly touching wood. We don't know exactly what is still to come. For the moment, limited fever, but the fever can be quite severe, and of course, that is a sign of seriousness of the condition. Blocked nose, dry nose. The nose seems to harbor a lot of viruses, which explains the huge contagiosity. So a lot of nose-based symptoms. So if you have that in this period of time, it's probably not a common cold, even though colds could be linked to other types of coronaviruses. But if especially your nose is dry and even burning, well, that sounds like quite typical symptoms. Same thing for the throat, dry, burning throat, severely achy throat, very suspicious symptom. Two symptoms that are highly relevant to this condition, very surprising, very new, is a loss of smell and a loss of taste. A recent study has been published about 10 days ago by University of Mons. It's an ongoing study, but some preliminary results have been published. In fact, it's centered in University of Mons, but it's a European study. And the number of patients with these two symptoms of lack of taste, lack of smell is massive, up to about 90%. So that's a very, very significant. If you have that in this period of time, you're probably experiencing an infection by COVID-19. Eyes can also be dry and burning. I was about to forget that one. Skin symptoms, rash, some rashes, unspecific, like you may find in many viral conditions. Chilblains, that is more interesting, and that has been described. I didn't have any such patient, but I read that several times. Fatigue is severe. Fatigue can be much more severe than in common flu. So any sudden episode of severe fatigue, even if you don't have clear-cut flu symptoms, I would be very suspicious of you having caught this virus. Some digestive symptoms can also occur. Would it be some nausea, loose bowels, aspecific, again, unspecific digestive symptoms? We know that the virus affects also the intestines, so you probably have infective capacity through stools, which is part of why we need absolutely clean hands. And of course, keeping in mind that the nose is the big, huge source of this virus, not touching your nose with your hands, because immediately your hands are contagious. And you know all those recommendations that have been vastly delivered to the population, I think, in the whole world. Very interestingly, a large number of patients remain asymptomatic, up to 50% probably, and that is strongly suggested by an Icelandic study which is ongoing. I have many Icelandic patients, and I've seen all the data from Iceland. Quite good management in Iceland, but there is a private company running those tests in collaboration with the government, and a lot of positive patients are in fact asymptomatic. And we also know from a different study that the virus can be transmitted up to 50% of times by asymptomatic patients who contagiate others. Either those will remain non-symptomatic or they are already contagious before the symptoms appear, but they will appear later on. So, of course, that's why this is spreading like crazy, because a lot of people are contagious without anything that could alert you about the fact. All that explains how important it is to be locked down. I cannot stress enough the need for being locked down. It would not be the case if the initial invasion of the virus was contained at earlier phases. But once it is spread throughout the population, and it is extremely aggressive for the moment, especially in big towns. It is everywhere. It's very difficult to do anything else than lock down people so that the number of cases is slowed down, and so that the hospitals are not overwhelmed. They are already overwhelmed like this. So you can understand what crisis we would face if there were no lockdown instructions put in place in most countries. Masks are, of course, useful. Everybody would have expected that. But I think governments and perhaps World Health Organization knew initially that there would be a massive shortage of masks. So some instructions have been given to keep those masks for the health care professionals and not generalized to the whole population. But of course that is going to come because that helps. It's not fabulous protection, but it is useful, and I can't see masks not being imposed. Probably sophisticated masks for professionals and more artisan masks for the community. Tests, of course, will not expand on the PCR test that spots the antigen. Those are being done in larger numbers. They were not available in big numbers in early stages, which probably was a big problem. They are not so easy to perform. You may have false negatives because you don't pick the virus, or the virus has already moved to the lungs and you can't get the virus in the nose or in the throat. So that's not so obvious. But what will be very interesting, and we have started to run those tests in my clinic in London. My colleagues are running them for you if you wish. Those are antibody tests which show immunization. Not 100% protection guaranteed because this virus is mutating very fast, so there might be an evolution in the virus structure that will make immune defenses fail at some point. That might be for the next round, next year, if there is such a thing. Some fastly mutating virus also go extinct because they lose their virulence. Let's keep in mind that also a virus that kills its host is doing a sort of suicide because it's the host that allows the virus to multiply, which might have been a factor for previous really nasty, highly deadly coronaviruses, SARS and MERS, in the previous years. Those epidemics have been quickly contained, but maybe that was helped by a highly virulent, highly lethal virus. This one is much less lethal, but much more contagious. So, in summary, we don't know much about this virus. It's impossible to know today if having gone through the disease will protect you, for how long. We don't even know if a future vaccine that will come out sooner or later will be protective, because if in the meantime the virus mutates, it's going to be a big problem. You know, the flu vaccine sometimes is very deceptive because by the time they design a vaccine against the flu, the virus has evolved and then the vaccine is much less effective. So all that is concerning, but I think functional medicine delivers a very helpful approach, and especially a powerful prevention based on natural strategy, not drug-based, as a prevention. And I will expose that in my Covideo II. I hope you don't mind the wording Covideo. I thought, why not? and I will present that in another 15-minute recording very soon. Thank you.